Women, especially in their middle years, face particular challenges regarding their heart health. These include atherosclerosis or clogged arteries and the effects of menopause. Our guest today, Dr. Ritu Thaman, understands and responds to these challenges every day. She's a respected cardiologist and researcher who focuses on cardiovascular disease in women. Dr. Thaman, thank you for being on House Calls.
Wonderful to be here.
Well, let's pick a number and get started. What should a woman who just turned 50 be thinking about when it comes to her heart health?
Well, it's an interesting question. Since cardiovascular disease is the number one cause of mortality for women, it should be on every woman's radar. And certainly as we enter middle age, late 40s, 50s, there are a lot of changes that are occurring physiologically, one being menopause. But in addition, the United States does not have a screening that is just for cardiovascular disease in women. We have it for other diseases, like certain types of cancers, but we don't have one specifically for women for cardiovascular disease. And so these are things that you must be aware and advocate for yourself when you do go see your doctor.
Thanks for making such an important point. As you mentioned, since there's no official screening, what are some of the signs women should look for that indicate they should consult their doctor?
Pay attention to what your body is saying to you. A lot of times, we put our needs behind everyone else's in the family, and we don't necessarily become aware that these subtle changes are happening. Some people may not have subtle changes. You might have palpitations, chest discomfort. It could be in the jaw and the ears. It could radiate into the back. But really paying attention to yourself and how you are feeling and noticing if there are major changes or even sometimes more subtle changes. That is something you should be bringing up and paying attention to.
Well, with everything they've got going on, women sometimes forget themselves. Share your thoughts about self-care and self-advocacy.
I believe that all women should advocate for themselves because I've seen so many patients over the years put themselves last, and they don't put value on taking care of themselves because they're so busy with helping and loving their family. But really, that is the key to taking care of your family, is taking care of yourself. So don't put yourself last. If you are having symptoms, if you do have risk factors, face them head on. If you aren't getting enough exercise, start something.
Dr. Thaman, thank you so much. It's been great to hear from you today. You've given us a lot to consider about women and their heart health. If you have questions about health conditions, I would love to hear from you. Comment below, hit subscribe, join me here next time for Answers You Can Trust.